Good morning. In the January issue of Vanity Fair magazine, and I know that everyone in this room gets the Vanity Fair magazine, teen star Lindsay Lohan reportedly admitted to having an eating disorder. She also confessed to having experimented with illegal drugs. After the story came out, Lohan denied the eating disorder, but not the drugs. Then earlier this month, popular comedian Dave Chappelle appeared on Oprah to explain his recent disappearance from his hit show on Comedy Central. Some had speculated that it was a result of a mental health problem. Chappelle vehemently denied it. He said, "I wasn't crazy. I wasn't crazy," he said, just under so much stress that he had to leave the country without telling anyone, not even his wife and children. He admitted that not telling his wife was definitely a mistake. But again, I quote, "It wasn't a crazy mistake." I tell these stories by way of explanation for why, although Bob gave me the opportunity to give you two actions that need to be taken, I want to give you one major social marketing goal that I think has to be accomplished if we are going to build the mental health system of the future, and that is to reduce stigma. If we don't reduce stigma or eliminate stigma, I believe there is no future for children's mental health care. In part, that's because we'll never be able to pay for it. There's simply never enough public money to go around. Mental health advocates will always have to compete for public and private dollars with other deserving causes. If we don't reduce stigma, if we don't break the public and the policymakers of the tendency to blame people for their own mental health needs, then mental health will never be deemed deserving, and we will never have the resources necessary to transform the system. The celebrity stories I just told illustrate the second reason why reducing stigma is the single most important social marketing initiative we have to undertake. Because if we don't succeed, the people in need, our children, our youth, our families, won't access the system for help. Think about it. If celebrities, who for better or worse are the role models in this country, can admit to just about anything, but can't admit to having mental health needs, how can we expect our children, our youth, our families to take that next step and seek treatment? Well, that's enough with the bad news, because I do believe there is good news. The good news is that, yes, change, transformation is possible. In a 1986 poll, 31% of people believed that people with AIDS should be quarantined. By 1991, that number had dropped to 10%. That's a 20% drop in just 5 years. In the 1950s, two women tried to place an ad in the New York Times to create a support group for breast cancer survivors. The Times wouldn't run the ad. They had a policy against printing both the word breast and the word cancer. And remember, we used to refer to it as the big C. Today, of course, all of that is unimaginable. There are lessons we can draw from the history of these two diseases that connect with the existing research on mental health stigma reduction. That research suggests that the most effective way to improve people's attitudes about mental health is to put them in contact with someone who has a mental health need. This method is rooted in the understanding that stigma and discrimination are possible only when we are able to pretend we have nothing in common with the group in question, that they are entirely different from us. Contact proves otherwise. With AIDS, Magic Johnson was that point of contact. Before Magic, AIDS was something that could only happen to other people. After Magic, AIDS was everyone's problem. The second effective way to reduce stigma is through education and awareness, and you've heard a lot about that from the speakers that came before me. Education is most useful when it's targeted at something very concrete, a specific myth that can be disputed by fact, like the myth that people with serious mental health needs are violent. Far more difficult is using education to tackle amorphous perceptions, attitudes, underlying even unconscious beliefs. This kind of education can and does work, but it requires patience and long-term commitment. In the mental health arena, frankly, we're just at the very beginning of the education process. In children's mental health, we're barely past the starting gate. At the Children's Campaign, one of the things we try to drive home to the system of care communities that we work with is that social marketing is everyone's responsibility, not just that of the social marketer. Social marketing is not just about major advertising campaigns or the media or big special splashy events. It's about how we, and I mean all of us, interact with our world every single day. So I'd like to leave you with a social marketing task that you can take on in the fight against stigma and discrimination. Part of the reason for the stigma surrounding mental health issues is that for many people, the very term mental health calls to mind negative, scary images of people being taken away, removed from their families and their communities, isolated in prison-like surroundings. Those are, of course, exactly what systems of care are not. And that is what I'm asking you to tell people. I'm asking you to talk about your work, talk to anyone who will listen, write letters to policymakers, write the media, write articles for publication yourself in lots of publications, not just journals. Be the social marketer that I know you can be. You have a lot to be proud of. Take credit for it and get noticed. Getting the word out about systems of care, about transformation, may well make someone in need just a little less afraid to seek help. That's a crucial step toward ensuring we don't end up transforming the system, but leaving behind the very people who need care. Eventually, I know we will transform not only the mental health system, but the world. Our children, our youth, our families with mental health needs have to wake up and take on every single day.